Hi, everyone. It's 4 o'clock in New York. After a bruising 24 hours of headlines about a maskless Donald Trump potentially spreading infection throughout the residence of the White House, and amid reports of a White House in a state of full-blown chaos after more than 18 people in Donald Trump's orbit have tested positive for the coronavirus, Donald Trump just in the last hour brought his COVID-positive body to the Oval Office. His chief of staff has reportedly been inside the Oval Office with him. That's despite Trump's ongoing battle with coronavirus and with no reason to believe that he's not still infectious and thus a danger to everyone and anyone who comes in contact with him. Trump has been pushing for a foray into the Oval since his return from Walter Reed Hospital, even as the New York Times describes the West Wing as a situation many see as, quote, spiraling out of control, adding, quote, the pandemic that Mr. Trump has treated cavalierly for months seemed to have locked its grip on the White House. Fears over the safety of the hundreds of people serving in President Trump's super spreader administration running in concert with worry over the political carnage evident in Donald Trump's standing in the polls. The Times adds this, quote, West Wing aides shaken by polls showing the president badly trailing Joe Biden, worried that they were living through the final days of the Trump administration. Those concerns only amplified by an erratic series of tweets last night, even for Trump. Trump abruptly calling off talks on coronavirus relief and then demanding Congress approve said relief or some version of it, all within the span of just a few hours. Presidential conduct so puzzling, as we said, even for Trump. Maggie Haberman and Annie Carney of the New York Times reported, quote, some White House staff members wondered whether Mr. Trump's behavior was spurred by a cocktail of drugs he's been taking to treat the coronavirus, including dexamethasone, a steroid that can cause mood swings and can give a false sense of energy and a sense of euphoria. The president's condition and its consequences for his White House, his campaign, and our country is where we start today with some of our favorite reporters and friends. Yamiche Alcindor, White House correspondent for PBS NewsHour's Back. Democratic strategist Basil Smikle joins us, and Dr. Michael Osterholm, director of the Center for Infectious Disease Research and Policy at the University of Minnesota. Doctor, let me start with you. Your analysis since the beginning has always been sober, but it's always been blunt. I mean, what are we possibly looking at when we analyze Donald Trump? For all his surreal antics, there's never been a question about his mental and physical state being altered by a untested drug cocktail that he's on to treat the novel coronavirus. What could we be witnessing in his conduct?
Well, since I'm not a clinician and I'm not taking care of him, I can only say that as an observer out here from the public health world, obviously it doesn't make a lot of sense. But then we have to look at the fact that we've had this challenge ongoing without a national plan, without a way to actually safely protect the West Wing from this virus. Right now, I'm not sure what is real and not. You know, the late Tom Clancy, the author, once said to me, the only difference between reality and fiction is that fiction has to make sense. And I'm afraid that I am among those who now believe that that might be true.
There's so many places we could go there. The other thing that I think confounds a lot of people is when you have a vice president that polls show people trust in the area of coronavirus more than they trust Donald Trump, frankly. Why not, if you're undergoing experimental care, and they've made a lot of the nature of his treatments being experimental, why not, I mean, just from a medical perspective, we'll dive into the politics with Yamiche and Basil, but why not transfer authority and control and focus on a recovery with a patient like the President of the United States?
Well, again, all I can say is that as a nation, we want our leaders to be of full capability to respond. And as someone who has personally experienced what it's like to be on steroids as such for a medical condition at one time, I can attest to the fact that it does create some real challenges of thinking. So I surely can't judge whether his thinking is different today than it was yesterday. I can just keep coming back to the fact that we have a hell of a problem with coronavirus right now, and we continue to be diverted into these kinds of issues and not addressing what's happening. For example, in the upper Midwest, where we're now turning on fire right now here, just like we saw earlier this summer in Georgia, Florida, Texas, Arizona, and California. And we're missing out on that story. We're focused right now on unfortunately, what's happening at the White House.
Well, let's correct that. that right here and right now. I mean, take me through, Dr. Osterholm. I mean, also, as I was coming up here, I saw a news flash that Boston has already announced that they will shut down all public schools there because their infection rate passed 4%. So is it your view that the virus is still raging across this country in an uncontained way?
Well, you know, Nicole, we had predicted over 2 months ago that probably post-Labor Day, when college students came back, we would first see a big increase in cases in that group. That would spill over into the public. What we've also seen is that basically so much of the public has now not only experienced pandemic fatigue, but as you're seeing, pandemic anger, people who don't believe that this pandemic is real. And therefore, not only do they not comply with public health issues, as we know we need to enforce to limit transmission, but they're actually flaunting, not supporting them. If you put that together with all the outbreaks we're seeing right now with funerals, weddings, family reunions, bars and restaurant visits, I can go through the laundry list. We're seeing a major increase in cases. And I think that within a few weeks to clearly, by the time of the election, this country could very well be far in excess of new cases per day than we saw earlier this summer when we were a house on fire. And I don't think we're understanding that. Just today in my adjoining state of Wisconsin here, they're now setting up tent hospitals in Milwaukee to handle the overflow of cases. This is going to just continue to get worse.
You know what, we'll put a pin in Donald Trump's roid rage and stay on this. I've got a few more questions about the current state of COVID in America. From what you just said, you talked about pandemic anger. What is the impact to that sort of low din of pandemic anger of a president who's diagnosed, who's hospitalized early after his diagnosis, treated with the best drugs available to a human being, coming out and saying, it's not that bad, don't let it dominate your life?
Well, first of all, as you so well know, and you've covered it very well in this show, you know, we've got over 200,000 Americans who have died from this virus, God knows how many around the world. All of those families, friends, colleagues, et cetera, they understand that it's not just simple. We also understand that many of them don't have access to the kind of care that the president had. And so, again, I wish the president, his family, and all those involved with the White House the very best. But as a nation, we are failing desperately in trying to deal with this pandemic right now. We need a plan. What is our plan? We don't have one. We didn't have a plan to protect the White House. And so I just keep coming back to that. As the case numbers begin to increase dramatically, we also need to ask ourselves, you know, it's not that I don't care what goes on in Washington, D.C., but in many ways I don't anymore because it's theater. And what we need to do is in public health, we need to understand on the ground we are losing this battle and more every day. So that's what we can focus on. And I appreciate that you have focused on that a lot in this show. And that's what we need to continue to do.